Hey everybody, Dr. Rafoth at Cascadia Dentistry. Want to talk about some things that I'm seeing more and more of, and it's a real concern. Lots of dental care providers are taking out teeth for patients, and more dental care providers are also providing implant care for people who lose their teeth. The concern lies in that you have to be very thoughtful, very calculated about what you're doing when you remove any teeth if you're planning to replace teeth with implant dentistry. The most important part of that is paying respect to the volume of bone that is required to place an implant in your head. So when a tooth is removed, bone atrophy begins. And bone atrophy is when you lose bone. So there's immediately a loss of bony tissue as soon as the tooth is removed. And that bone atrophy can continue until there's something that is actually in the bone. The reason why patients have bone support and don't lose bone over time in their jaws is because they actually have teeth for the most part. Patients don't suffer bone loss. But for patients who have dentures or are losing multiple teeth to tooth decay or periodontal disease, as soon as those teeth come out, the clock is ticking on how much and how fast bone atrophy occurs. There's other bone defects that happen. Sometimes you get an abscess in a tooth and it can infect the bone, and then the bone is already compromised. So what is all this leading up to? Well, it's leading up to the concern I have in seeing patients more and more nowadays that have bony defects where teeth used to reside. These bony defects are very difficult to correct and overcome if patients want to be committed to implant dentistry to replace those missing teeth. So, in my next video, we're going to talk about my recommendations for what patients should be thinking about and asking of their healthcare providers when we're getting a tooth out. Okay, thanks.